Good evening and welcome to tonight's episode of Dr. Melissa Medicine Woman. I am so delighted that you have joined me this evening. Tonight, we are going to be talking about our bones and how we can do a body good. Now, this skeletal structure that we have is really the foundation for our entire being. Okay, our skeleton, when you look at a skeleton, from the head to the toe, there's bones that connect. And we're going to talk about those tonight. So I'm Dr. Melissa Medicine Woman and Dr. Melissa Balizan. I have over 26 years experience in both Eastern and Western medicine. And tonight I'm going to give you a little disclaimer, as I do on all my shows, because this is for educational purposes only and not intended to diagnose, treat, or prevent any disease or psychological disorder. The content tonight is specific for you, to educate you. A specific physician-patient or pharmacist-patient relationship is necessary before any medical therapies are initiated. So please consult your physician, other qualified healthcare professional, pharmacist, or other professional provider with questions that you have about your medical conditions, and before starting or using any dietary supplements, herbal remedies, exercise, or nutrition plans. So on Dr. Melissa Medicine Woman, we do discuss things, whether or not it's appropriate to be on all the medications that you're taking, the supplements that you're taking. We ask ourselves, is it time to ditch the pills? Because I want you to know that you have a voice and a choice when it comes to your health. You're only given one body, and I want you to be able to utilize it well. And to give you a little bit more information about myself, I am been in pharmacy for 26 years now, and I have over 52,000 clinical hours. I've helped thousands and thousands of patients to optimize their health, streamlining what they're taking, saving them money on supplements and medications that are not necessary. My physician friends call me the deprescriber because I pull off those medications and supplements that aren't needed. We do backfill sometimes with lifestyle medicine, and we support you in ways where drugs, that's right, drugs, medications, over-the-counter supplements are not necessary. I get to the root cause of the problem, and I am your concierge consultant pharmacist, and I'm happy to be with you here this evening, sharing this important information about osteoporosis. And it's very near and dear to me that I share this with you tonight, because according to the Center for Disease Control, that over 50% of women over the age of 50 have low bone mass. Well, what does that mean? Low bone mass can contribute to osteoporosis. And osteoporosis is really where your bones become weak and brittle. So brittle that even minute stresses on your body, your skeletal structure, can cause a break. A cough can cause a break. Bending over can cause a break. Now that's pretty significant, right? So why does this happen? Well, bone is living tissue, and so we are constantly breaking down our bone and replacing it. And what happens, when osteoporosis occurs, it happens because we are not replacing the bone as fast as it's breaking down. Okay. Now, certain groups are affected more than others, typically post-menopausal women over the age of 50. They're affected by this because one of the benefits of estrogen is it helps keep your bones nice and strong. So when your estrogen drops, your bones can become brittle. And we're going to talk more about that in just a minute. So some symptoms, I want to talk about the whole aspect of this. So we're going to go from symptoms all the way to how to prevent and treatment. Okay. So when we look at symptoms, now some of these are non-specific. Back pain, back pain could be a symptom of osteoporosis, especially if it's caused by a fracture or collapsed vertebrae. Okay. Stooped posture. So you notice people that they walk a little stooped, or they stooped over. This could be a symptom of osteoporosis. Losing height. Have you ever noticed somebody your especially older women, they say, I'm shrinking. That could be a symptom of osteoporosis. Okay. A bone that breaks more easily. Okay. I have a friend who she broke her knee. Well, it's not very common to break your knee. That's one thing that's a little bit more difficult. And she's had a broken wrist, she's had a broken knee, she had a broken ankle. Well, what happened is her bones are really brittle. She has osteoporosis. And so we talked about it, and she's doing things to help prevent future breaks and doing things to help bone regrowth. Okay. Now, menopause, as I said earlier, could put you at risk of osteoporosis. Also, if you have taken corticosteroids for several months at a time, especially, or either of your parents have had hip fractures, this typically will put you at a higher incidence to potentially have osteoporosis. So what happens? We talked about that bone grows over time. And so our bones are breaking down, and then we grow new bones. So when we're younger, we're building bone, we're growing, and our body makes bone a lot faster than we're breaking it down. But as we age, now this typically hits our peak bone growth in the 30s, 35 years old. That's when we're not making so much bone that is breaking before it's all broken down. So as we age, that puts us at risk. Okay. As we age, that puts us at risk of developing osteoporosis. Now, if you were to look at your bone under a microscope, and I thought that this was important to tell you about, when you look at your bone under a microscope, it looks like a honeycomb. So, or is like a honeycomb. You'll see all those little spots for the honey to go in. Now, if you have osteoporosis, you have a lot bigger breaks. Okay, so there's a lot more porous areas. So instead of those teeny tiny little bitty honeycombs, you have big blotches. Okay, so you don't have as much bone together. Now, risk factors. Okay, now let's talk about risk factors for osteoporosis. Aging. As we get older, we're not making bone as fast as we did before, and especially if we start decreasing using more bone than we can make it, that's osteoporosis. Certain races are at higher risk. Sometimes our lifestyle choices can put us at risk. Medical conditions and treatment. That's right. So you could be being treated for another condition, and that could put you at risk. Okay. So when we talk about age, the older we get. Now, women who are listening and watching, much more likely to develop osteoporosis than our male counterparts. Okay. Now, Asian descent, that is also a higher incidence that we've seen to have the chance for osteoporosis. A family history. So you have a mom, a dad, a brother, a sister who has osteoporosis or have had a hip fracture, then that can put you at increased risk. Now, smaller body sizes, okay? smaller body sizes have a higher risk because they overall have less bone mass. Okay, so if you think about your skeleton, if you are smaller shape, you have less bone that makes you up, and you have a higher risk of osteoporosis. Now, we talked briefly a little bit about estrogen, and I want to talk about estrogen. So estrogen is protective of bone, okay? So when you have low estrogen or postmenopausal estrogen drops, then that tends to weaken bone, okay, and can put you at risk for osteoporosis. Now, another hormone that affects us is our thyroid. So too much thyroid hormone, too much, can cause bone loss. So if you have an overactive thyroid, so your thyroid is putting out way too much thyroid hormone, that can reduce your bone. If you're taking medication because you have an underactive thyroid and you're getting too much medication, that can reduce your bone and put you at increased risk of osteoporosis. Okay. Now, things that we consume, and we'll talk about how to increase these things. So if we have low calcium intake, this can put us at increased risk of osteoporosis. You probably, you've heard the saying, milk does the body good, right? So it does, because it helps to build strong bones. We need calcium in our bones. We need vitamin D to help process the calcium to get into our bones. And what happens with that is that helps create bone growth. So when we're younger and we're growing and we're going from infancy to toddler to adolescent, our bones are growing, and we need that calcium source. So there's milk that we're drinking, or we're getting calcium in a source. If you don't get a lot of calcium if you're younger, so if you have a milk intolerance and you haven't got a lot of calcium, then there's a possibility that that's going to put you at increased risk of developing osteoporosis later in life. Now, we talked about medications. We talked about corticosteroids, especially several months' time. Now, steroids are used for many different things. People get steroid shots to help relieve inflammation. People use steroids for breathing. There's a lot of reasons why we use steroids, and long-term use of steroids can put you at increased risk of osteoporosis because it's breaking that bone down. Okay. Now, osteoporosis has also been associated with other medications that are used to treat conditions such as seizures, GERD, gastric reflux, cancer, transplant rejection. So those particular medications, when people have been on those medications, they have shown that it puts them at higher risk of developing osteoporosis. So you really have to look at your risk benefit when you're going on a medication. Is that medication treating my heartburn, but is it going to put me at risk of osteoporosis? So you've got to weigh the pros and the cons. Okay, so you've got to look at that. Now, they've also discovered that certain medical conditions, such as cancer, rheumatoid arthritis, celiac disease, and inflammatory bowel disease have also been shown to put people at increased risk of osteoporosis. Okay, so you get diagnosed with a new condition, and that particular condition, because the way that it's acting in your body, maybe you're not able to absorb certain things like celiac disease or inflammatory bowel disease or rheumatoid arthritis. Your body is fighting it, so you're not able to absorb the nutrients that you need to build that strong bone. So those are medications and medical conditions that can put you at increased risk. Okay, so even if it puts you at increased risk, and so you weigh the pros and the cons, and you need to be on the medication to treat that condition. You have that condition, you've been diagnosed with it, and we want to prevent osteoporosis. Okay, stay tuned. We're going to get there of what you can do. Now, lifestyle. Lifestyle plays a role. Okay, so those who have more of a sedentary lifestyle, so they sit around more often, have a higher risk of osteoporosis. We talk about, in the past, I've talked multiple times about functional movement. Okay, we want to be able to move around and functionally move. We want to expand and contract our muscles. We want to utilize our skeleton to move around. So when we are doing weight-bearing activities, when we're on our feet, we're helping to prevent osteoporosis. Good posture, standing up straight, sitting up straight, that keeps our bones in check, and it actually helps to prevent osteoporosis. Some things that you can do to help prevent osteoporosis: limiting the amount of alcohol that you're drinking. Okay, now alcohol, there's maybe a time and a place for it, but alcohol has shown that excessive alcohol can decrease our bone loss. So that puts you at risk. They've also shown that tobacco usage has shown to put you at higher risk of osteoporosis. So if you are a smoker, I recommend you to stop. It's going to be healthier for you to stop. Your lungs are going to love you. You're going to start tasting and smelling all of these great new things once you stop smoking. And you're going to be at less risk for osteoporosis. So osteoporosis can lead to fractures. Okay. Now, the fractures in the hips are very common. All right, and often caused by a fall. Okay. Now, this can even result in disability and even death, especially after the first year of the injury. I have had clients fall down, end up in the hospital, have surgery, hip fracture, have surgery. Some have gone out, got back on and done well. Others, after that fall, after the surgery, they got up, they do well for a little while, and then something happens and they are no longer with us. So that in itself puts you at higher risk. Okay. Now, when we look at that, that's the spine. When we look at the skeleton, the vertebrae, okay, the bones that make up the skeleton, the vertebrae. Now, sometimes those collapse, okay, those collapse and crush. And because your bones are brittle, so they're collapsing, they're crushing, you're shrinking, you're getting smaller, and you might have a hunched posture, okay, which then causes back pain. So it's a compounding effect, and we want to make sure that we can do everything in our power to do a body good, to make it so that we don't put ourselves at increased risk of osteoporosis. So we talk about whole body health. We talk about lifestyle choices. We talk about good nutrition, regular functional movement, moving our body, keeping our bones healthy. Now, let's talk about the amount of calcium that we need. So there's a couple of minerals we're going to talk about. We're going to talk about calcium and vitamin D. Calcium. Good sources of calcium found in milk, dairy products, green leafy vegetables. Green leafy vegetables, very, very common place to find calcium. So if you can't drink milk or dairy, get those green vegetables in, okay? Also, salmon, sardines, tofu, yogurt if you can do, dairy, great sources of calcium. Now, the amount of calcium that you need, according to the FDA, is between 1,000 and 1,200 milligrams. So if you are under the age of 50, the recommendation is 1,000 milligrams. If you're over the age of 50, the recommendation is 1,200 milligrams. Now, you have to make sure that you're getting, it's preferable, let's say that, it's preferable to get as much calcium from the food that you're eating as possible. Now, some things are fortified with calcium or fortified with calcium and vitamin D. Cereals, orange juices, things like that. Here's the thing, too much calcium, especially in supplements, can lead to kidney problems, can lead to kidney stones. So you want to make sure that the food that you're eating and the supplements that you're taking equal no more than 2,000 milligrams of calcium. Excuse me. Thank you. No more than 2,000 milligrams of calcium. That is crucial because you don't want to cause more problems. You don't want to get kidney stones. You don't want issues with that. Okay, so that's your calcium. Now, the next thing we're going to talk about is vitamin D. Now, let's actually back up a minute. If you're getting supplementation, so good quality supplementation, we've talked about this in the past, you've got to make sure that you're not throwing your money away. Don't buy supplements at the big box store, at the big pharmacy chains. You need to go to a reputable source, probably a concierge pharmacist like myself, to get you good quality supplementation, and you're not spending a lot more money. But what I've done is I've vetted out companies that pay attention to what's in the bottle, because those supplements are not regulated. They're not regulated. And we want to make sure that you're getting what's in the bottle and not anything more, not anything less. We want to make sure it's safe for you. Supplementation is not required to follow any kind of guidelines. They're not required to do checks. They're not required to do third-party testing. They're not required to test their raw ingredients, their final product. Those are key things that you need to look for when you're looking for a supplement that you're taking. Don't just throw it away. Don't just throw your money away. So vitamin D. Now, vitamin D and calcium are buds, okay? Vitamin D helps to absorb the calcium, okay? And what it does is it helps to make sure that that calcium goes into your bones. So vitamin D is necessary to absorb the calcium into our bones. And vitamin D can be found in great nutritional products: cod liver oil, tuna, trout, salmon, egg yolks, mushrooms, and even sardines are a great source of vitamin D. Who knew that? I didn't realize there was that much vitamin D in mushrooms until I did my research. Now, so many of us, we live in the northern hemisphere, we live in higher elevation. We can get vitamin D from going out in the sunshine as well. But those of us that do live closer to the sun, the higher elevation, we're not getting as much sun. And we put on sunscreen when we go outside. When we put on sunscreen, we're blocking the vitamin D from coming in and absorbing in our skin. So sometimes you have to take a supplement to get enough vitamin D, because you really need about 600 international units of vitamin D a day. Now, as you get older, over 70, you need about 800 international units a day. So you might need to take a vitamin D supplement, good quality, making sure that you're getting that calcium absorbed. Now, vitamin D supplements, if you aren't getting enough vitamin D from your sunshine, and you're probably not going to get as much as you need from nutrition as well, take a look and you might get a supplement. Now, you don't want to go over a certain amount, because you can get vitamin D poisoning as well. You need to make sure that you get in your testing, your vitamin D levels. It is a lab we can test for. We can see where you're at. Now, a lot of people are very deficient and they have to be on higher doses of vitamin D. Now, the average person can probably supplement with about 4,000 to 5,000 international units of vitamin D a day and be just fine, hit the levels right, feel good, no issues. But not always. So check those levels. Check those levels. Now, I also wanted to bring one more supplement that can cause a problem in deficiency of bone, and that's magnesium. Okay, and there's a couple of studies out there that have shown that magnesium, people with a higher magnesium level have higher bone density. Really? So magnesium is great for all kinds of things. Magnesium is great to help you sleep. It's great for leg cramps. And now it's even good for your bones. Now, good sources of magnesium: pumpkin seeds, spinach, cashews, black beans, peanuts, edamame, and even dark chocolate. Now, not too much because there's risk benefit, pros and cons. So, moving our bodies, functionally moving our bodies. When we move our bodies, we're training them, we're strengthening them. Now, strength training and weight bearing activities. Strength training are things that you do to strengthen your muscles. So lifting weights, upper arm, things like that. Those are your strength training. You can strengthen training your legs as well. But when we talk about weight bearing, those are things that we're on our feet. So we're putting our weight on our bones and our muscles. Walking, jogging, skipping rope, skiing, climbing stairs. Those are all things that can help our bones, okay? And they impact our legs, our hips, our spine. Now, exercises like yoga and Tai Chi that help you to balance can help you, especially as you get older. Remember, I talked about even just bending over can cause issues, can cause you to have a break. So if you are practicing balance, that's great for your core. That's great for your bones. So practicing Tai Chi or yoga can help you balance. Now, how do you get diagnosed? Okay, so osteoporosis is a test. There's a test that we can run. We can check your bone density. It's a non-invasive. You put your foot in your foot and your ankle in a machine, and we measure the bone density. We scan it. Sometimes you get on a table, and we can check your bones. We can check to see. Sometimes we'll do a scan all the way up to your hips, but there are mobile scanners where we can just do it quickly with your foot. So if you have osteoporosis, then do all of these things I've talked about, because these are preventive things and will help you even if you get diagnosed. Okay. Now, do you need to have treatment? Well, you need to weigh the pros and the cons. Treatment for osteoporosis includes everything we talked about: calcium, vitamin D, magnesium, exercise, not smoking, all of these things. And possibly you might need to be put on a medication called a bisphosphonate. Now, bisphosphonates have been around for a while, and they help to help slow down the progression, slow down the bone breakage, okay? But there's some serious side effects: nausea, abdominal pain, heartburn-like symptoms. You must take it on an empty stomach, 30 minutes, remaining upright. So you take the pill on an empty stomach with a full 8 ounces of water, and then you must sit upright and allow that pill to slide down your esophagus and get into your stomach. because it can cause esophageal erosion if not. And it can also cause a very, very bad break in the thigh bone. And there has been some studies shown that if you're on these bisphosphonates and you have invasive dental procedures, so you have a tooth pulled, it can cause problems with your jaw. So talk to your dentist before having a tooth pulled. Let them know you're on this particular medication. Is it the right thing for you? Is it going to help you? What is the pros and the cons? Now, there is another class of medication. It's denosumab. Now, this is Prolia. This is a shot that you get every 6 months. It's very similar to the bisphosphonates in that it helps to produce and strengthen the bone density. It helps to reduce your risk of fractures. That's what the bisphosphonates and the denosumab does. It helps reduce your risk of your fractures, okay? But same thing can happen with a thigh bone break and the jaw problem. So risk benefit, what's your risk of falling down, having a fracture, ending up in a hospital bed, not being able to recover versus taking the medication, doing these other things to help strengthen your skeleton. Now, hormones. We talked about how low estrogen puts you at increased risk. So sometimes going on estrogen therapy could help benefit and strengthen your bones. But there's risk. Higher levels of estrogen postmenopausal have put you at risk for breast cancer, blood clots, strokes. Not good. Risk benefit. What's the benefit over the risk? Now, there is a medication called raloxifene, and it mimics those effects of estrogen. What it does is it helps to increase that bone density, especially in postmenopausal women. And it even might reduce the risk of some breast cancers. Okay, so those are some examples of medications that may be the right thing for you for a short period of time or may not. There's also bone building medications. Okay, so there are medications that are specific to help grow new bone. But these medications are short-term medications. You can only be on them, one of them for a year. The other two are for 2 years at the max. So Forteo, Tymolus, and Evenity, those are medications to help build bone. But they're short-term. And then you have to go on a different medication. You're doing your calcium, your vitamin D, your magnesium, your movement, your functional movement, your nutrition. You're paying attention to what you're eating. You're getting that calcium in. You're limiting your alcohol. You're not smoking. You're making changes to reduce your risk of osteoporosis. Reduce your risk of a fall. If you have osteoporosis, I recommend that you don't wear heels. Making sure that you're closer to the ground. Okay, so when we wear those heels, number one, potential for balance interruption. You fall down, you're farther from the ground. So prevent the falls. Pay attention. Use grab bars, use hand rails. Keep your rooms brightly lit so you can see where you're going. You're not tripping over something, you're not falling down. Okay, so I've given you a lot of information tonight, and I want to let you know that whole body health is a key piece. We're paying attention to what we're doing for our lifestyle. We're paying attention to what we're doing to help prevent osteoporosis. And before starting a medication or supplement, it's important to know at least 5 questions that I've put together for you to ask your healthcare provider. All right. And or your physician or your pharmacist. And so I want to share this link with you, just for you who are watching tonight. And it is drmelissabalizan.com/TV. And when you go to this link, I have those special offers just for you that are watching tonight. Go in and get those. Find out what you should be asking before starting a medication or a supplement. Write down your questions when you go into the physician's office. Ask your questions. If you're going to be screened for osteoporosis, what vitamins are you already taking? What are you already doing? What kind of food are you already eating? What treatments are available? These are additional questions you might want to be asking specifically for osteoporosis. Think about it. Have you broken bones? Have you gotten shorter? Do you have low back pain? Do you need to be screened? What are your activities that you're doing? Do you have to restrict certain activities? What can you do to prevent falls? So these are key things that I want you to think about, and I want you to ask when you're going to see your physician about osteoporosis. And be sure and go and pick up those free resources on the 5 questions to ask. And you can book an appointment with me at drmelissabalizan.com/TV. It's been a pleasure having you with me this evening. Take care. And remember, you only get one body. So take care of it today, because we never know. We're not promised tomorrow. Have a good night.